involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen-to-estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, 𝒔𝒐𝒄 emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. Guide 61: Understanding acne in specific sports and athletic activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne treatment during immunosuppression and immune compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur.
Welcome, and thank you for taking this time for yourself today. Before we begin, let's take 3 slow, calming breaths together. Breathe in deeply through your nose, hold for a moment, and exhale gently through your mouth. Again, breathe in, feeling your shoulders relax, and breathe out, releasing any tension. One more time. Breathing in peace and breathing out stress. Beautiful. Now let's talk about something that affects so many of us, hormonal acne. Hormonal acne is one of the most frustrating skin concerns because it can feel unpredictable and overwhelming. Unlike other types of acne, hormonal breakouts often appear in specific patterns and at specific times, making them easier to identify once you understand what to look for. Today we're going to explore how hormones affect your skin, what makes hormonal acne different, and most importantly, how to care for your skin through these hormonal fluctuations with gentleness and patience. Let's start by understanding what hormonal acne actually is. Your skin has tiny receptors that respond to hormones circulating in your body. When certain hormones fluctuate, particularly androgens like testosterone, your skin's oil glands can become more active. This increased oil production, combined with changes in how skin cells are shed, creates the perfect environment for clogged pores and inflammation. Hormonal acne typically appears along your jawline, chin, and lower cheeks, though it can also show up on your neck and back. What makes hormonal acne different from other types is its timing and pattern. You might notice that breakouts appear like clockwork before your menstrual period, or they might worsen during times of stress or hormonal transition. These breakouts tend to be deeper, more painful, and longer lasting than surface-level pimples. They often appear as cysts or nodules under the skin, rather than whiteheads or blackheads on the surface. Understanding this pattern is the first step in managing hormonal acne effectively. Now, let's talk about the hormonal cycles that affect your skin. During your menstrual cycle, hormone levels rise and fall in a predictable pattern. In the first half of your cycle, estrogen levels are higher, which generally has a positive effect on skin. Estrogen helps keep oil production balanced and supports collagen production. However, in the second half of your cycle, progesterone levels rise and testosterone becomes more dominant. This shift stimulates your oil glands to produce more sebum, setting the stage for breakouts. Stress hormones also play a significant role in hormonal acne. When you're stressed, your body produces cortisol, which can trigger increased oil production and inflammation. Chronic stress can keep cortisol levels elevated, creating a cycle where your skin never gets a chance to calm down. This is why you might notice that your skin breaks out more during stressful periods at work or in your personal life. Managing stress isn't just good for your overall well-being, it's an essential part of caring for hormonal acne. Major hormonal transitions also affect your skin in profound ways. Pregnancy brings dramatic hormonal changes that can either improve or worsen acne. Some women find their skin clears beautifully during pregnancy, while others experience breakouts they never had before. Postpartum is another time of significant hormonal shift as your body adjusts to no longer being pregnant and possibly to breastfeeding. Perimenopause and menopause bring their own changes as estrogen levels decline and the ratio of androgens to estrogen shifts, often triggering breakouts in women who never struggled with acne before. Let's discuss how to care for skin with hormonal acne. The foundation is always gentle cleansing. Use a mild pH balance cleanser twice daily to remove excess oil without stripping your skin. Avoid harsh scrubs or cleansers that leave your skin feeling tight and squeaky clean. That strip feeling tells you that your cleanser is too harsh, which can actually trigger more oil production as your skin tries to compensate. Look for cleansers with calming ingredients like chamomile or green tea that won't inflame already sensitive skin. Salicylic acid is particularly helpful for hormonal acne because it can penetrate into pores to dissolve the oil and dead skin cells that cause clogs. Start with a product containing 1 to 2% salicylic acid, using it once daily to see how your skin responds. You might use it as a cleanser, toner, or leave-on treatment. The key is consistency and patience. Salicylic acid works over time, not overnight, so give it at least 6 to 8 weeks before deciding if it's helping. Niacinamide is another excellent ingredient for hormonal acne. This form of vitamin B3 helps regulate oil production, reduces inflammation, and supports your skin's barrier function. It's generally well tolerated even by sensitive skin and can be used both morning and evening. Look for serums with 5 to 10% niacinamide, applying them after cleansing and before moisturizing. Niacinamide works beautifully with other acne-fighting ingredients, making it easy to incorporate into your routine. Retinoids deserve special mention when discussing hormonal acne. These vitamin A derivatives help regulate skin cell turnover, preventing the buildup of dead cells that contribute to clogged pores. They also help reduce inflammation and can improve the appearance of acne scars over time. If you're new to retinoids, start with an over-the-counter retinol product 2 or 3 times per week, gradually increasing frequency as your skin builds tolerance. Apply retinol at night to clean, dry skin, followed by your regular moisturizer. Moisturizing is absolutely essential, even for oily, acne-prone skin. When you skip moisturizer, your skin can become dehydrated, triggering even more oil production. Choose oil-free, non-comedogenic moisturizers that hydrate without clogging pores. Gel-based or lightweight lotion formulas work well for most people with hormonal acne. Ingredients like hyaluronic acid provide hydration without heaviness, while ceramides support your skin's protective barrier. Sun protection is non-negotiable when treating acne. Many acne treatments, particularly retinoids and acids, make your skin more sensitive to sun damage. Use a broad-spectrum sunscreen with at least SPF 30 every morning, even on cloudy days. Mineral sunscreens with zinc oxide or titanium dioxide can be particularly good for acne-prone skin because these ingredients also have anti-inflammatory properties. If you find traditional sunscreens too heavy, try gel-based or fluid formulas designed for oily skin. Spot treatments can help with active breakouts, but use them carefully. Benzoyl peroxide is effective at killing acne-causing bacteria and reducing inflammation. Start with a 2.5 or 5% formula, applying it directly to blemishes rather than your entire face. Be aware that benzoyl peroxide can bleach fabrics, so let it absorb completely before touching towels or pillowcases. Tea tree oil is a natural alternative with antibacterial properties, though it should always be diluted before applying to skin. Now let's talk about what to avoid. Resist the urge to pick or squeeze your blemishes. Hormonal acne cysts are deep in the skin, and squeezing them only pushes bacteria deeper, increases inflammation, and raises the risk of scarring. If you have a particularly painful or persistent cyst, see a dermatologist who can safely inject it with medication to reduce inflammation quickly. Trying to extract it yourself will only make it worse and last longer. Be cautious with thick, occlusive products on acne-prone areas. While face oils and heavy creams might be lovely for dry skin, welcome to this soothing, supportive space. Breathe deeply and slowly, feeling peace enter your body. Today we're talking about soothing inflamed acne, how to calm angry red, painful breakouts with gentleness and care. Inflamed acne can be physically uncomfortable and emotionally distressing. Those red, swollen, sometimes painful pimples demand attention, but the instinct to attack them aggressively often makes things worse. Instead, let's explore how to calm inflammation gently, supporting your skin's natural healing while minimizing discomfort and preventing scarring. First, understand what inflamed acne is. When a pore becomes clogged, bacteria can multiply in this oxygen-deprived environment. Your immune system responds by sending white blood cells to fight the bacteria, creating inflammation, redness, swelling, warmth, and sometimes pain. This is inflamed acne, papules, pustules, nodules, or cysts. The inflammation itself is part of your body's healing response, but excessive inflammation can damage surrounding tissue and lead to scarring. Our goal is to support healing while calming excessive inflammation. The foundation of soothing inflamed acne is gentle care. Harsh treatments, aggressive cleansing, picking, or strong actives increase inflammation and delay healing. Treat inflamed breakouts with the same tenderness you'd treat any wound. Start with gentle cleansing. Use a mild pH balance cleanser that doesn't strip your skin. Avoid scrubbing or using rough tools near inflamed areas. Gently massage your cleanser with your fingertips, using light circular motions. Rinse with lukewarm water, never hot, which increases inflammation. After cleansing, apply anti-inflammatory treatments. Several ingredients specifically calm inflammation in acne. Benzoyl peroxide kills bacteria and reduces inflammation. Use 2. 5% concentration. Research shows it's as effective as higher concentrations, but much less irritating. Apply as a spot treatment directly on inflamed pimples or as a thin layer over acne-prone areas. Be patient. It takes several days to see results. Salicylic acid, while primarily known for unclogging pores, also has anti-inflammatory properties. A spot treatment with 2% salicylic acid can help reduce inflammation while preventing new clogs. Niacinamide is beautifully soothing for inflamed acne. It reduces inflammation, supports barrier function, and helps regulate oil. A serum or moisturizer with 5% niacinamide can be used over your entire face twice daily. Azelaic acid has both antibacterial and anti-inflammatory properties. A treatment with 10 to 20% azelaic acid can help with both active inflammation and post-acne marks. Sulfur has natural antibacterial and anti-inflammatory properties. Spot treatments or masks with sulfur can help calm inflamed breakouts, though the smell may be unpleasant. After treatments, always moisturize. Inflamed skin needs hydration and barrier support. Use a lightweight, non-comedogenic moisturizer, even on broken out areas. Look for soothing ingredients like Centella asiatica, green tea extract, or aloe vera. Specific soothing techniques for very inflamed, painful acne. Apply a cold compress for 5 to 10 minutes several times daily. Wrap ice or a cold pack in a soft cloth and hold gently against inflamed areas. Cold reduces blood flow to the area, decreasing swelling and numbing pain. Use hydrocolloid acne patches on pimples that have come to a head. These absorb fluid, protect the spot from touching and bacteria, and create a moist healing environment that reduces inflammation and prevents scarring. Apply diluted tea tree oil as a spot treatment. Tea tree oil has natural antibacterial and anti-inflammatory properties. Dilute it significantly, 1 drop tea tree oil to 9 drops carrier oil, and apply only to specific pimples, not all over your face. Consider taking an anti-inflammatory supplement like omega-3 fatty acids or turmeric if appropriate for you. These can help reduce systemic inflammation, though consult a healthcare provider first. What not to do for inflamed acne. Never ever pick, squeeze, or pop inflamed pimples. This spreads bacteria, increases inflammation dramatically, damages surrounding tissue, and leads to scarring. Keep your hands away no matter how tempting it is. Don't apply harsh products hoping they'll work faster. Strong acids, high percentage benzoyl peroxide, multiple actives at once. These irritate already inflamed skin and prolong healing. Don't use hot compresses or steam on inflamed acne. While this might feel soothing, heat increases blood flow and can worsen inflammation. Don't cover inflamed acne with heavy, pore-clogging makeup. If you must cover it, use light, non-comedogenic mineral makeup and remove it thoroughly in the evening. Lifestyle factors significantly affect inflammation. Manage stress, which increases cortisol and inflammatory responses throughout your body. Practice stress reduction techniques, meditation, breathing exercises, gentle movement, creative activities. Sleep adequately. During sleep, your body produces growth hormone and performs repair work. Inflamed acne heals faster with good sleep. Stay hydrated to support your body's inflammatory response and healing processes. Eat anti-inflammatory foods, fatty fish, berries, leafy greens, nuts. Some people find that dairy or high glycemic foods worsen their inflammation. Observe your body's responses and adjust accordingly. Avoid touching your face, which introduces bacteria and irritates inflamed areas. Keep your pillowcase clean. Change it daily if possible during active breakouts. Use a clean towel for your face or dedicate a small face towel you wash frequently. Be extra gentle with your skin everywhere, when applying products, when drying your face, when resting your face on your hand. Inflamed skin is sensitive and easily aggravated. Time is part of the healing process. Even with perfect care, inflamed acne takes time to resolve, typically several days to a couple of weeks depending on severity. Be patient and consistent with your gentle care. For severe or cystic acne that's very inflamed and painful, see a dermatologist. Prescription treatments, antibiotics to reduce bacteria, cortisone injections to quickly reduce inflammation, prescription retinoids, or even isotretinoin for severe cases may be necessary and appropriate. Monitor for signs that you need professional help. Acne that's very painful, cystic acne that persists, acne that's getting worse despite home care, or acne that's causing significant scarring or emotional distress. As we close, remember, inflamed acne needs gentleness, not aggression. Calm inflammation with soothing treatments. Protect your skin from further irritation. Support your body's healing with good self-care and be patient with the process. Your skin is working to heal. Support it with tenderness and it will respond. May your inflammation calm gently. May your breakout